Good morning. It's day 2 of our radical night repair and I'm doing the 10 pumps morning and 10 pumps night. So I've already did my wash today with my exfoliation cleanser, and I have also did a little exfoliation because my skin was a little dry and tight this morning. I had some flakiness on that as well. I'm also going to try and do my oil control pad today. I don't know how I'm going to get on. My skin is tight, as I said, so I do have my calming toner just in case if I don't manage to do that. If you can see, my skin this morning is very shiny and it's beginning to get tight now, and all around here all starting to flake as well. The forehead is absolutely fine. Okay, so let's try and see if we could do one of the control oil pads and see how we're going to get on this morning with this. So I say I might not get too far with this because the skin is a little tender today, but at the moment it's a little nippy, but fine. I'm going to continue with this and just cross it into the chin and under the nose. Okay, so that is stinging a little bit, and you can see how red the skin goes after that. Okay, so next I'm going to continue with my firming serum. Can't do without that. Okay, so we're going to do 2 pumps, my normal routine, and again using that one finger and a little on the eye as well. Round into the jawline. Remember this little oral connoisseur because this is my problem area. I tend not to use it any other way, and any other area as well. Okay, so that's firming serum applied. Okay, so I'm going to do the same 2 pumps of my Daily Power Defense, and again I always use the same technique to apply, and using that one finger. And with the Daily Power Defense, I like to get right into the orbital rim. And the next pump goes on to the other side of the face. And once all that's rubbed in, that is my next step done. Okay, so our last step of this morning's routine is our 10 pumps of the Radical Night Repair. So here we go. 10 pumps, and again we're just going to adopt the exact same routine using that one finger, and again always avoid that orbital rim right into the hairline. If you have a little tip, any eyebrows that have been painted, just avoid obviously that area. Things like microblading as well, you may take away some of the colour, so just try and avoid this area here. And again, remember you're going to get diffusion at that orbital rim, so we don't want to go any further. Okay, so once all that's applied, again with the remaining part you have on your hand, okay, what you want to do is just take it off your hand and then gently pop that onto the neck. And that is my 10 pumps for the morning. So join me again this evening for day 2. Good evening, everyone. So we're now here at day 2 in the PM, and it's about 12 hours coming up since I did the first 10 pumps, and my skin is certainly much drier and tighter, so I don't know if you can see, certainly the eye area here, that it's very tight and it's very, very red. But this red is a good sign because that's the sign of deep repair, and this is what we want to achieve with the peel. I'm going to change things a little bit tonight. I'm not going to use the oil control pad. It was a little bit stingy this morning. So I am going to change to the calming toner. I'm not sure how well this is going to go, and we'll give it a go. And tomorrow I'm going to change to the gentle cleanser. I've been using exfoliation cleanser, but that's got salicylic acid 2% in it, which is very good for acne and for oil. However, when you get to about day 2, day 3, it does make a huge difference, and it does start to sting a little bit. So I've already done my wash. I'm not doing any more exfoliation. I did that this morning, so we'll go ahead and we'll do the next steps. Okay, so toner, let's go and try and see. So with the toner, I still like to soak both sides. So I still like to do one side on the right side of the face and the other side on the left side of the face. So let's go and see if this is any easier. Certainly a little better, but it is starting to sting a little bit. Again, we'll get right into the jawline and into the nose and across into the mouth area. So it is stinging a little bit, and you can see where it does go very, very red, even after the calming toner is done. Okay, so we'll let that soak just for a little sec, and then we'll do the next step. Okay, so our next step is the Daily Power Defense. Now, this has got a small amount of retinol already in it. Not every patient that we do on the protocol will use the Daily Power Defense. I love to use the Daily Power Defense every day, morning and night. This helps to stimulate fibroblast activity, which in return will help boost collagen. So very good to use. Again, it's going to sting a little bit because we are day 2 into the PM. So again, I'm going to use just 2 little pumps onto the back of the hand. And again, we're just going to pop some of this product on. So you don't need to use this when you're doing the Bootcamp peel. However, if you have it at home, certainly use that. And again, I do put it at the eyes. However, this is stinging at this stage, but again, it's bearable. Okay, so once you have all of that applied to the skin, you can see there's going really red at the moment again. Okay, so that's the next step done. And finally, into our last product of the evening, our retinol 1%. Now, I've had a lot of questions because we have a lot of patients on this at home, and one of the questions was, can you still do exercise while you're doing the peel? Yes, you can. In fact, I go out running in the mornings and generally do about 6 miles with my dog. And although your skin is very, very tight, the most important thing I say to the patients is always make sure you put your sun protection on when you go out. The skin is a little bit tight, but other than that, there's no problems with that. So yes, keep exercising. So let's go ahead and do our final routine for this evening, which is the 10 pumps. Okay. And again, just going to apply this all the way around into the whole cheek area, just at the eyes. So I imagine tomorrow my skin will be raw. I've done this many, many times before. It does get easier, but I generally do it twice a year. So my skin has built up a lot of tolerance. So maybe some people who will get a lot more side effects than myself. But generally, the more retinol you use over the years, the better the skin condition gets. Now, what I did also notice was my 2 areas of hyperpigmentation where I had the coal sores are fading already. So that's a good sign. And again, what do we do with the last part is we just take it from the hand and then just pop that onto the neck. So all I want to do is feather that onto the neck. I do feel my neck's itching a little bit today. So that's us. Second evening, 10 pumps, and we'll see you tomorrow morning. Good night.